rehabilitation physicians currently practicing at REGEN Rehabilitation Hospital in Section 13, Petaling Jaya. I would like to introduce everyone to what rehabilitation medicine is, what type of patients we deal with, and also how is the current rehabilitation medicine services setting in Malaysia. So as for myself, like any of the specialists in training, I've gone through the government side. After that, we go to university for our postgraduate program. And then I was working for 5 years in Perkeso Rehabilitation Center in Malacca. And then now I'm in the private hospitals. So basically I've worked through all the different settings. We are doctors who go into specialist training, and we call ourselves as rehabilitation physicians. So we deal with patients with chronic illnesses for conditions that cannot be cured completely at the first instances. And our role is actually to optimize the patient's function and outcomes in the long term. For those that cannot cure completely, we will be focusing on helping someone to deal with activities of daily living and ultimately to improve their quality of life. For those patients that can improve a lot better, then we will be looking at going back to work, returning to work. So this is where my previous role with Perkeso deals with a lot. And currently we're also practicing it in the government side or also in the private side. To give you a clearer picture, typical patients that we handle include stroke. It can be an ischemic stroke or it can be a hemorrhagic stroke, accidents that end up with traumatic brain injury, or any kind of brain insult, or we call it as acquired brain injury. Injury to spinal cord that end up with paralysis is called spinal cord injury. Those severe accidents with limb loss, we also deal with amputations. So as you can see, this group of patients has many medical conditions to go through, and they end up with some forms of physical or cognitive disabilities. And as a rehabilitation physicians, we are here to help you to plan a proper rehab plan so that you can achieve the recovery first and foremost, and secondarily to improve yourself to the best possible functional outcome. So we work with many other disciplines like physiotherapists, occupational therapists, psychologists. We also have a vocational counselor, psychological counselors also comes in at certain point. We work together as a team and with the patient as the most important person to craft out a rehabilitation program to where someone wants to recover and how to live a life after a debility. And in the current setting, rehabilitation service is available in all major government hospitals in Malaysia. And there's also a handful of us in private hospitals. And in years to come, we can see that many rehabilitation specialists will be all around in the country. So in my field of experience, I have also used LEGA machine. LEGA is actually a chest percussion machine, which is very helpful in certain conditions. For example, after operation, any kind of operations where you involve general anesthetics, in the ICU setting, in the beginning phase, there will be a lot of secretion pooling in the lungs. This is where LEGA machine will come in to actually give the chest percussion to loosen the secretion. Combine it with some medications such as mucosolvan or even Flumisil and acetylcysteine. This will greatly enhances the ability of a patient to actually cough out the secretions. And why we want to do it early is because this will help with early extubation, meaning that taking it out from the tube and ventilators. And second thing, by reducing the secretion, we can reduce the risk of chest infections. So similar condition will be also experienced in patients with more severe stroke, where they are paralyzed in the first instances. Spinal cord injury, high level cervical, where patients also paralyzed in bed. So management of the chest secretion is actually extremely important, because at one end we want to recover, at one end we want to improve functions. All these chest infections or other things that happen along, we call it as a complication, will actually set back the recovery process. So this is where I use LEGA regularly to help to remove the secretions to achieve what we want, meaning that avoiding complications and also achieve earlier extubation. Physicians, we deal with patients from all age groups. We deal with very young patients, for example, in fact, we started it off from the babies, If a patient has been born with some complications during delivery, rehabilitation medicines can help from in the very beginning stage. Then for children with chronic conditions such as cerebral palsy, autism, or even developmental disorders, rehabilitation physicians can also come in to do the assessment and give advice for early intervention. We call it early intervention programs. And of course, we work closely with the pediatrician in this aspect. Then as the children transition into school age, rehabilitation medicine can also come in to plan the learning evaluations and also what accommodation is required in school. In this aspect, we again work together with the pediatrician, but this time we also bring in occupational therapists and also child psychologists to come up with a proper planning. Adolescence will be a critical phase whereby the children will be transitioned into teenagers and also into adulthood. So again, the life changes is also happening when someone with a physical or cognitive conditions. We also have to follow up patients and work with the patients accordingly at each phase of their life. Majority of my patients will be in the adult age group, as you can see. Spinal cord injury, limb loss, or even severe accidents. Quite common in Malaysia, unfortunately. We have very high rates of motor vehicle accidents. So the simple one, usually we can cure and recover fully. However, the more severe ones, such as end up with amputations, everything, we also comes in and provide different kind of services. For example, for limb loss, we will be doing evaluations and also prescribe the proper prosthesis. And following that, do the training and also planning with how a person can actually go back to the work, go back to the previous job using a prosthesis. So these are things that we deal with. Then as someone go into older adult age group, then we started seeing a lot of heart attack cases, stroke, or even because of fall and now with traumatic brain injuries. And these are neurological conditions that rehabilitation physicians deals with a lot. Then going further and further, geriatrician will also comes in. So our areas a bit overlap with geriatrician in terms of treatment for stroke or degenerative neurological conditions such as Parkinson's, but usually we work hand in hand, and we also work in a multidisciplinary manner.